The Ministry of Health continues to stress the need, of a nutritional diet in the fight against COVID-19. Kenya has recorded in the latest update 492 new infections out of a sample size of 4,063. This brings the total national count to 26,928. 331 are male, while 161 are female. 534 people have recovered, bringing the total number of recoveries to 13,435. 3 people have succumbed to the virus, and Nairobi has the highest count of new infections at 357, followed by Garissa at 57. Kiambu has recorded 37 new patients, Kajiado 14, and Machakos 13. Helen Aura now looks at the guidance on return to work for those who have recovered from COVID-19, as well as the dietary requirements.
The Ministry of Health continues to stress that the fight against COVID-19 is partly to be won on the diet front.
Get foods from all the groups, especially proteins are very important, both animal-based and plant-based protein.
The country has lost only 1 minor, according to the ministry's publicized reports. Afya House says that the young ones are weathering the storm well.
Of course, infants mainly get exposed because their parents, especially mothers, during breastfeeding. So far, we have only lost 1 infant, a 6-year-old, who had a problem with a bone marrow, a condition called aplastic anemia. So they get the disease, but they weather the storm very, very well. But that notwithstanding, of course, we still espouse breastfeeding as the best food for the baby. So even if the mother is positive, the mother must breastfeed.
With corporates urging many to work from home, those many who still need to physically report to their workplaces, concerns have been raised over the cases of those who are infected and recovered and have resumed duty.
10 days of a positive COVID-19 test and your symptoms are improving, you don't have a fever, you don't have to take medicine to bring your temperature down, then you are good to go back to work. But ensure again that you maintain the same infection prevention control measures.
Health CS Mutahi Kagwe and his team were in Kericho County, which so far has 308 isolation beds, even as testing capacity remains a concern.
Sensitization and training of our health care workers, which is at 95%. Health education to members of the public. Screening at the entry points to all our health facilities. Screening of travelers passing through Kericho, contact tracing and follow-up, quarantine of suspects at KMTC Kapkatet, testing of suspected cases, isolation of confirmed cases, testing of healthcare workers, protection of frontline healthcare workers, recruitment of additional 126 healthcare workers beside the 176 universal healthcare recruited staff.
I knew they would test, but I didn't know just how efficient and effective this institution is. And yes, they can test as much as you had said, 8,000, but they have to have the reagents. Now, on the issue of the reagents, it is a global concern. It's a global challenge. It is not that the Ministry of Health is not fighting to get these reagents. We are fighting as much as we can. Don't forget we used to test 100, 200, 300 people per day. Now we are on to 4,000, 7,000, 8,000 even. It is according to the availability of the reagents.
The government says that at least 15% of the COVID-19 related deaths in the country are young people aged between 20 and 40 years.
As the youth of the country. So just wear this, make it as fashionable as you want to, wash your hands, and then let's get along in terms of trying to recover as a country from this pandemic.
Helen Aura, NTV.